Hello everyone, I am G. Akshaya. Today I propose to elaborate on continuation of Chapter A in Community Medicine. From this purpose, we will concentrate on the topic of detailed explanation of natural history of disease. Now, we will go through this video. In last video, we will learn about introduction of natural history of disease. Today, let's continue the portion. Let's start. Natural history of disease. Definition: natural history of disease refers to the progress of a disease process in an individual of time. In the absence of intervention, we do the prevention according to the history of the disease. The process begins with exposure to or accumulation of factors capable of causing disease without medical intervention. The process ends with recovery, disability, death. In recovery, like flu for example, most people recover from it when taking medications. I would like to ask a question. Why it is important? It is one of the major elements of descriptive epidemiology. Understanding the progress of disease process and its pathogenetic chain of events in must for the application of preventive measures. So if the patient develops a certain disease, we will be also to know the signs and the duration of it. Okay, let's know about schematic diagram of the natural history of disease in a patient. It is a framework to understand the pathogenic chain of events for a particular disease and for the application of preventive measures. It is consist of two phases. One is pre-pathogenesis, second one is pathogenesis. Pre-pathogenesis is the process in the environment. Pathogenesis is the process in the man. Let's learn briefly. First one is pre-pathogenesis phase. This refers to the period primarily on the onset of disease in man. The disease agent has not yet entered man, but the factors which favor its interaction with the human host are already existing in the environment. This situation is frequently referred to as man exposed to the risk of disease. And second heading is pathogenesis phase. This phase begins with the entry of disease agent in the human host. After the entry, agent multiples and induces tissues and physiological changes. The disease progresses through the period of incubation and later through the period of early and late pathogenesis. The final outcome of the disease may be recovery, disability or death. In chronic disease, the early pathogenesis phase is less dramatic and is also called the pre-symptomatic phase. During pre-symptomatic stage, there is no manifest disease. The pathological changes are essentially below the level of the clinical horizon. The clinical stage begins when recognizable signs and symptoms appear. By the time signs and symptoms appear, the disease phase is already well advanced into the late pathogenesis phase. And next heading is spectrum of disease. It is a graphic representation of variation in the manifestations of disease. At the one end of disease spectrum are subclinic infections, which are not ordinarily identified, and at the other end of fatal illness. In the middle of spectrum lie illnesses ranging in the severity from mid to severe. These different manifestations are the result of individuals' different state of immunity and receptivity. Next of all, learn about levels of prevention. First type is primordial prevention, primary prevention, secondary prevention, tertiary prevention. Primordial prevention. It is the prevention of the emergence or development of risk factors in population groups. For example, many adult health problems like obesity and hypertension have their early origin in childhood. So, efforts are directed towards encouraging children to adopt healthy lifestyles. And third topic is primary prevention. It can be defined as action taken prior to the onset of disease, which removes the possibility that a disease will ever occur. They are at high risk but they don't have the disease yet. So we interference with the stage of prevent the disease for happening, elimination and modification of risk factors. Third topic is secondary prevention. It is defined as the action which stops the progress of a disease at its initial stage and prevents complications. It reduces the prevalence of the disease by shortening its duration. It may also protect others in the community from acquiring the infection and thus provide as a one. Secondary prevention for the infected individuals and primary prevention of their potential contacts. And last one is tertiary prevention. These include all measures undertaken when the disease has become clinically manifest or advanced with a view to prevent or delay death, reduce or limit the impairments and disabilities. Third one is minimize suffering and promote the subject's adjustability to incurable condition. Thanks for watching my video. This concludes part 2 of Natural History of Disease. Thanks for tuning in. Keep learn and grow. Thank you.